Good evening and welcome. I'm Sheila Balgobin and I am the Dream Decipherer, and I help you to sleep sound and dream deep. This evening I decided to focus on the heart of sleep, literally, and look at the impact that sleep or the lack of it can have on heart health. Now, we already know that sleep is essential for good health anyway, and particularly for a healthy heart. People who don't sleep enough are at risk for cardiovascular disease and coronary heart disease, regardless of their age, whether they smoke or not, or whether they exercise or not. Getting enough good quality sleep is important if you want to lower your risk for these conditions. There's new research that's come out recently that suggests that there's a link between poor sleep and atrial fibrillation when the heart beats irregularly. Sleep problems, including sleeping too little or too long, along with sleep disorders such as breathing irregularities and insomnia, may be linked to a variety of factors that can raise the risk for cardiovascular disease. This, according to the American Heart Association's statement on sleep and heart health, published in their journal called Circulation. There was data presented by researchers from the University of California in San Francisco during a symposium on heart health back in 2016, which revealed the possible link between disruptions in sleep and the risk of an irregular heartbeat, which is known as atrial fibrillation. Some of the key takeaways from this research included disrupted sleep, including insomnia, may be independently associated with atrial fibrillation. People who reported frequent nighttime awakenings had about a 26% higher risk of developing an irregular heartbeat compared to those who didn't wake up a lot. And finally, people who were diagnosed with insomnia had a 29% higher risk of developing atrial fibrillation compared to those without insomnia. It isn't completely clear why less sleep is detrimental to heart health, though researchers do understand that sleeping too little causes disruption in underlying health conditions and biological process such as glucose metabolism, blood pressure, inflammation levels, and the production of certain hormones, including hormones to help you to sleep. The same thing may be true with regard to sleeping too much. One of the reasons, though, that the sleep is vital to the heart is that patients with sleep apnea, where breathing is interrupted or stops, causes them obviously to wake up frequently during the night because they're not breathing, often have compromised heart health. Ooh, can't get that out. This is because without long, deep periods of rest, certain chemicals are activated that keep the body from achieving extended periods of lower heart and blood pressure rates. Over time, this lack of giving the heart and blood pressure time to settle and relax can lead to higher blood pressure during the day and a greater chance of cardiovascular problems. There are apparently a number of studies which highlight the relationship between sleep apnea, where breathing stops occasionally, and cardiovascular disease. One study found that over an 8-year period, men with severe sleep apnea were 58% more likely to develop congestive heart failure than men without the breathing disorder. However, it doesn't take a severe underlying sleep disorder to see the heart being impacted. Poor sleep due to perhaps working, changing work schedules or shift work, or for whatever reason, inadequate sleep habits can also put people at risk of having heart problems. Now, there's also research which not only shows that too little in sleep in life could take its toll, but there's evidence to indicate that it's important that we start looking after our hearts from a young age, because heart problems can develop from too little sleep, whatever your age may be or condition. For example, in one study, adolescents who didn't sleep well were at greater risk for developing cardiovascular problems. And you hear about all of these young footballers suddenly keeling over with heart attacks, or actually died from because of heart problems that were undiagnosed, that they were unaware of. One possible reason for that may be that these young people are not getting quality sleep, and it's putting strain on the heart. And while they don't show any indications of being ill or having heart problems, the lack of sleep is telling on them, and it's impacting their health and even causing death in some cases. What they found during these studies was that teens who didn't sleep sufficiently presented with higher cholesterol levels, a higher BMI or body mass index, in other words, the amount of fat that the body is carrying, larger waist sizes, higher blood pressure, and an increased risk of hypertension or high blood pressure. So it's easy to see how these alterations in childhood health could snowball into major concerns later on, which is why it's important to develop good sleep habits from an early age, and to maintain those healthy routines throughout life. So there you have it. This is a short live, but a very important one, and just to remind us all that how essential sleep is for every organ and system in the body, particularly the heart. Thank you so much for watching and listening. Have a fantastic evening and a great week to come, and I'll see you again soon. Take care. Bye-bye.